You know, the United States has some of the best doctors, the best hospitals, the best medical research in the entire world. And yet, we have this massive paradox. For a country that spends more on healthcare than anyone else on the planet, our results are, frankly, pretty bad. So how is that possible? How can you pay the most and get the least? Well, today, we're going to unravel this very American mystery. So when it comes to one thing, the United States is number one, the undisputed champion of the world, and that's healthcare spending. We spend more money per person than any other wealthy nation out there. But this is one gold medal you really don't want.
Because when you look at what we actually get for all that money, in terms of, people's health, the US ranks dead last, 10th out of 10 comparable countries. So what on earth explains this huge gap between the money going in and the results coming out?
To really get our heads around this, we have to look at the data. And the first thing that just jumps right off the page is the sheer amount of money we're talking about. The numbers themselves are staggering, but they paint a really, really clear picture.
Just take a look at this. The U.S. spends a way bigger chunk of its national wealth, its GDP, on healthcare than any of its peers. It's not even close. You see countries like Australia, a top performer providing fantastic care for a fraction of what we spend. The U.S. is a massive outlier here.
So what do we get for being such a big spender? This is where that paradox just smacks you in the face. Despite outspending everyone, the U.S. healthcare system ranks last, dead last, in overall performance. And meanwhile, Australia, who spends way less, they're sitting right at the top.
And listen, this isn't just one bad grade. The system is failing across the board. The U.S. is last in being able to even get care when you need it. It's near the bottom in equity, meaning there are huge gaps depending on how wealthy you are. And maybe the most damning thing of all, it's last in health outcomes. Americans are just not living as long, and they're suffering from preventable diseases more than people in any of these other countries.
So why? Why is this happening? If we're throwing more money at the problem than anyone else, why are our results so terrible? It's the multi-trillion-dollar question, right? But the answer is surprisingly simple.
For a long time, the common wisdom was that, Americans are just overusers of healthcare. We get more tests, more surgeries, more hospital stays. But when you actually look at the data, that story completely falls apart.
The real reason our costs are so high isn't how much care we use. It's how much we pay for it, the prices. For the exact same drugs, the same procedures, the same MRI scans, Americans pay prices that are just astronomically higher than anywhere else. We're not getting more healthcare, we're just getting a much, much bigger bill.
And this gets to the heart of why those prices are so inflated. You've got this unbelievably complex insurance system that creates mountains of paperwork and just waste. And at the same time, you've had all these hospitals and clinics merging together, creating these giant systems that can pretty much charge whatever they want.
So how did we even get to this point? I mean, a system this uniquely expensive and inefficient, it wasn't built in a day. It's actually the result of 100 years of decisions that took the U.S. down a totally different road from the rest of the world.
While other countries were building systems to cover everyone, the U.S. did something different. It started back in the 20s with private plans. Then, during World War II, tying health insurance to your job became the norm. And later, in the 60s, the government stepped in with Medicare and Medicaid for the elderly and the poor. Each of these steps just added another complicated layer, creating the patchwork employer-based system we're stuck with today.
All of this history, it brings up a really important question. If the American way isn't working, what can we learn from the countries that are actually getting it right? What are they doing that we're not?
Well, when you look at top-performing countries like Australia, the Netherlands, or the UK, a few things really stand out. First, they all have universal coverage. Everyone's in. No one falls through the cracks. They also keep costs for patients really low, so money is never the reason you don't see a doctor. And finally, they all have really strong primary care systems. Your local family doctor. That's the foundation of a healthy population. And in every single one of these areas, the U.S. is just far behind.
Now, you'd probably think that a system performing this badly, this inefficiently, must be a financial disaster for the companies involved, right? Well, when we look at the actual business side of U.S. healthcare, we find the exact opposite is true.
So this shows us the projected profits for the U.S. healthcare industry. EBITDA, that's just a key way to measure financial performance. The industry is already wildly profitable, raking in over $670 billion. But look at the forecast. In just 5 years, those profits are set to jump by over 45%, getting close to $1 trillion a year.
And that leaves us with a really tough, fundamental question. In a system that delivers the worst health outcomes at the highest cost, but also generates record-breaking profits, how do we ever shift the focus back to where it belongs, to the health and well-being of patients? It's a question that's going to define the future of American health. For more explainers on the issues that matter, please subscribe to BW News.